Hello, I am Dr. Prasad Kaspik, a practicing surgical oncologist from Mumbai. And today's video is about demystifying cancer. So welcome to All About Cancer, your A to Z guide. So if you are someone who is suffering from the disease or just want knowledge about cancer, then this video is for you. So let us start this video with complete clarity and thought. So stay with me, because at the end of this video, I'm going to tell you the most important step that one should take after diagnosis of cancer to help improve your odds of battling the disease. You do not want to miss this one. Okay, so let's get down deeper into what are cancers and what are its types. So basically, cancer is when one of your cells goes rogue. Our body is made up of multitude of cells which work in the form of birth, function and death in a timely manner, and this all works like clockwork. But when one of these or many of these cells sort of fall out of this pattern and start behaving in their own manner, then those cells are called as cancer. Cancer is not just one disease, but is actually a multitude of diseases acting in a similar manner which are clumped under a generic term. So breast cancer, for example, affects the breast. Lung cancer affects the lung. Your colon cancer might affect the colon, while your skin cancer will affect the skin. All of them divide, multiply and spread to other parts of the body. But if you go into its intricacies, each one is completely different from the other. Hence, all their treatments, their protocols and everything is different. Cancer basically occurs because there are two systems in our body. One is known as your proto-oncogene system, which promotes cell growth and division, and the other is known as your tumor suppressor system, which basically helps to destroy cells and kill cells in our body which are not required or have outlived their function. Now, when there is an imbalance in these two systems, where the proto-oncogene either increases or the tumor suppressor gene system is suppressed, then in such cases cells go rogue and then turn into cancer. Want to know more specific information about cancer? Then please join this channel and subscribe to us, as we will be continuously sharing videos and information about cancer and its various subtypes. So why is it that cancer occurs, or what is the main cause of cancer? Basically, number one is a genetic susceptibility. People of certain types are more prone to develop cancers as compared to people of certain other types. But if you look into the organic causes, number one is smoking. Smoking and tobacco usage is by far the most common and lethal cause of cancer and has been linked to mouth cancer, throat cancer, lung cancer, bladder cancer, well, almost each and every cancer. Second is a diet. Those people who have poor diet, who eat outside food, have a lot of preservatives or basically tinned foods, are at a higher risk of developing cancer. Inadequate sleep, increased stress, and such basic psychological factors also have a propensity for developing cancer. There are certain viruses such as your HPV virus, which is associated with cervical and mouth cancer, and also hepatitis B virus, which is associated with your liver cancer, are also associated in cancers. So what is the main takeaway from all this? Number one is that yes, not every smoker develops cancer. And why? Because of genetic susceptibility. And number two, small changes in your lifestyle, such as just quitting smoking and alcohol, or two, just improving your diet, taking adequate sleep, can definitely reduce your cancer risk multifold. So here is the most critical part I had promised you at the start of the video. The first step that you need to do when you're diagnosed with cancer is build your team. Cancer is not a disease that is limited to a single treatment option or a single person. It has to be handled by multitude of people, from your surgical oncologist, your medical oncologist, your radiation oncologist, your support staff like your physiotherapist, your speech swallow therapist, and many more. So when you get diagnosed with cancer, understand your disease and start building your team of doctors who are going to help manage you. Now remember one thing, every patient is unique and every cancer is different. So every plan of treatment is not the same for two similar people. So you must understand, and that is why teamwork makes all the difference in ensuring that you have the best outcome and the best results of your treatment. So the number one thought on the family's mind after treatment is how to afford it. Now, cancer treatments can be very overwhelming, not only from the physical and mental aspect, from the financial aspect as well. So as I said earlier, you have built your team. So that team now makes a proper cancer treatment plan for you. Before you start spending on your treatment, understand what your treatment is, the course of your treatment, the duration of your treatment, and what all you will be needing to do during your treatment time. So that is a very good way of financial planning as well. You must understand one thing, that cancer treatment is not limited to only surgery. There can be chemotherapy, radiation, and a multitude of other things. And one's wallet should not run dry during this course. So hence, once you have the plan in place, number one, if you have an insurance, talk to your insurance person and find out in which hospitals or centers the treatment can be carried out in totality based on your insurance budget. If you don't have an insurance, then based on the finances you have, plan your hospital and your doctor team properly. In the given scenario that even that is expensive for you, then there are many trusts and NGOs that help cancer patients, and it is your right to take help from them if you are a deserving person, because at the end it is a life saved. Money can always come later. Okay, there are certain associations like the Chief Minister's Fund, some trusts, they provide large amounts of funding towards cancer patients, provided your doctors are the right team of doctors who are qualified to treat you for the condition. So understand with your doctor, your hospital, or your insurance agent the entire costing and the treatment protocol before you jump and start your treatment. So the most important question is, can cancer come back after you've completed all this treatment?